You know, David, there's this saying that goes, if you want to predict the future, create it. And right now, BYU has that chance with the launch of their new medical school.
Oh, I like that. But wait. Hmm. Are they predicting or defining the future of healthcare? Because those two paths sound like incredibly different.
Exactly, that's the crux of it, right? BYU faces what you might call a fork in the road. They can either prepare their students to thrive in the healthcare system we have now, which, let's be honest, is, well, deeply flawed in so many ways, or they can take the riskier but far more impactful road of developing a medical program that pushes us toward a new paradigm of health and well-being for everyone.
Okay, so here's my everyman question for you. Are they starting from scratch here? A blank slate? Or are they trying to retrofit today's notoriously messy system into their curriculum?
Well, BYU does have the opportunity to create something truly new and visionary, but that's not easy. Health systems worldwide, including in the US, have deeply entrenched structures, financial incentives, and cultural norms. Even when you dream big, you're not just fighting against the status quo, but also trying to predict where future needs and challenges will arise.
Right. It sounds kind of like trying to design a plane while it's flying. Like you can add better wings or, I don't know, fancier engines, but if the core is flawed, sooner or later you're hitting turbulence no matter what.
Exactly. And that's the challenge for Dr. Mark Ott, the inaugural dean BYU just appointed. His team has to decide, are they essentially training doctors for the healthcare system we currently live with, or are they leading a transformation toward healthier communities, preventative care, equitable access, all the things we wish our system could be but often isn't?
Oof. That's such a big question, though. Like, how do you even decide between fixing what's broken versus basically changing what's there? I mean, doesn't that kind of decision, ripple out into everything? Teaching methods, the kinds of students they admit, even the partnerships they build?
It does. And let's not forget, this isn't just any school, it's a medical school. It sets expectations for not just doctors, but the entire system they'll work within. I mean, imagine the impact BYU could have if they aim to cultivate doctors who prioritize well-being over profit, who treat patients rather than diseases, who see healthcare as a collective responsibility instead of a commodity.
Whoa, slow down there, Dr. Ramirez. I'm already picturing a futuristic utopia with floating clinics and AI-powered everything. But seriously, is there any evidence that schools, like BYU's new program, could actually start pushing the needle on this stuff? It feels like a David versus Goliath fight here. Like literally, system versus individual.
It's not easy, that's true. But historically speaking, there are precedents for paradigm shifts like this. Change often comes from those bold outliers who challenge what's considered normal and possible. And that's what makes this so fascinating to me. Whether BYU will just join the ranks of existing schools or if they'll carve out something revolutionary. You know, David, this reminds me of a moment in history. Picture this. It's the late 19th century, and medicine was, well, unrecognizable compared to what we know today. Doctors didn't follow uniform education paths, hospitals were rudimentary at best, and the healthcare system was, to put it mildly, chaotic and unscientific.
Oh boy, I'm already picturing smoke, leeches, and what? Like people handing out questionable tonics on street corners?
Pretty much. But then, a group of visionaries, not just doctors, but women, scientists, donors, came together and said, what if we could do better? What if we completely reimagined what medical education and healthcare could be? That's how Johns Hopkins Medical School was born, and what they created set the gold standard for the future of medicine.
Whoa, hold on. Women? Back then? I mean, I thought they weren't even allowed in these kinds of spaces.
Exactly why it's remarkable. Women like Mary Elizabeth Garrett were instrumental. She was one of the key donors, actually, and her involvement came with conditions. She demanded that Hopkins accept women as medical students on the same terms as men, which was groundbreaking at the time. Talk about disrupting the status quo.
Wait, what? That's amazing. So this wasn't just about building a medical school. It was almost like social innovation too?
It absolutely was. They didn't just rethink medical education. They rethought who should have access to it and who should be shaping it. And because of that, Johns Hopkins went on to become a hub of research, innovation, and leadership that influenced medicine worldwide.
All right, I'm officially inspired. But, why does this matter for us? More than a century later? What's the takeaway?
Good question. There are lessons here for anyone trying to design something transformational. The first one is vision. Hopkins wasn't just about training doctors, it was about advancing science, public health, and humanity. Everything they did was rooted in purpose.
Okay, I'm with you.
Second, collaboration. They brought together people from completely different worlds, academics, philanthropists, practitioners, and cultivated a shared goal. Third, they challenged norms. They didn't just tweak the system, they broke it apart and rebuilt it with entirely new principles.
Wow. So they were like the ultimate disruptors. Very on brand for the tech guy over here. What else?
Fourth, they tied everything to research and evidence. It wasn't about guesswork or tradition, it was about testing what would actually work. And finally, they thought big. They weren't afraid to dream of something that seemed impossible. Those 5 lessons, vision, collaboration, challenging norms, evidence-based design, and bold thinking, are as relevant today as they were in the 1890s.
Yeah, but how does someone even start applying those lessons today? Like, is that even realistic in our entrenched system?
Well, that's the million-dollar question, right? Designing a system from scratch comes with challenges they didn't have back then, but also opportunities they could have never imagined. That's the challenge, right? And it's exactly what the founders of Johns Hopkins faced. They weren't just building a medical school, they were rethinking what an institution could do for society.
Wait, you mean they weren't just like cranking out doctors to keep up with demand?
Not at all. They realized that if they wanted to revolutionize medicine, they also needed a premier hospital, which was a pretty novel idea at the time, and postgraduate medical training programs. They weren't just following what existed, they were following a vision.
Huh. So it was almost like creating an ecosystem, not just a single solution. It's kind of like building an app and realizing you also need the whole platform, hardware, software, everything, to make it work, right?
Exactly. And it's the same story today. Any new medical school like BYU's has to take into account society's broader needs, things like health equity, efficiency, and most importantly, the idea that health is a system, not just a collection of individual parts. And it exists within a larger societal system. And that means we don't only need visionary physicians, we need teams, nurses, public health experts, administrators, all working together.
Okay, but let's be real here. You're saying BYU, or any other new medical school, can't just focus on making great doctors? They've got to think about everyone else on the healthcare team too?
Absolutely, well, if they want to contribute to transformational change. Medicine today isn't just about the physician. It's about creating what we call system stewards. These are people, doctors, nurses, health managers, who understand how to navigate and even reshape the larger system. Otherwise, we're stuck in the same cycle we've been in.
And BYU has what? A nursing school and some other health-related programs already, right?
Exactly. They've got a nursing school, a public health program, health management studies, anthropology, statistics. All of those fields could co-evolve alongside this opportunity. It's not just putting them under one roof, it's about fostering collaboration from the ground up to tackle health systems challenges together.
All right, but that sounds like, I don't know, a lot of moving pieces. How do you even get them all moving in the same direction?
That's where the shared vision comes in. It's not enough to just have the right parts. Those parts need to align around a purpose that goes beyond convention or profit or prestige. And that's perhaps the most ambitious challenge of all. That's a great question, David. When you're talking about a system with so many moving parts, it's a truly bold vision that can align them, bringing people, institutions, and even the entire system together around a shared purpose.
All right, but what does bold really mean here? Bold like aspirational goals? Or bold like, hey, let's flip the whole system upside down?
Bold in a way that pushes boundaries. It's not just about surviving in today's healthcare system. It's about designing, catalyzing, creating a system that genuinely serves everyone. That's what BYU has an opportunity to decide. Do they want to forge ahead with healthcare's status quo, or do they challenge themselves to create something new, something truly transformative?
Okay, but to be fair, doesn't that sound kinda overwhelming? Like they're gonna take on a system this massive? It feels like trying to push a mountain uphill.
It's a monumental task, but history is full of examples of this kind of bold thinking. It's the same kind of mindset that fueled Johns Hopkins back in the day, challenging norms, breaking away from tradition, and designing a system to advance humanity, not just follow conventions.
Right? So is BYU's medical school just going to say, let's turn every graduating doctor into superheroes, or?
That might be one interpretation, but it's more about equipping them to think systemically, about health equity, prevention, and whole person care. The vision isn't just for the students or faculty, it's for the impact on patients' lives, on fostering healthier communities.
Huh. So it's bigger than just the school. It's a whole philosophy?
Exactly, which is why the central question remains, what kind of future are they building? Is it one that addresses our existing system of rescue care, profit-driven models, and prestige? Or can they pave a new path towards something we've always wanted but haven't fully achieved, a healthier society for all?
And what's stopping them? Like, why not just leap at this bright, shiny new paradigm and go all in?
Because the reality is, bold visions disrupt. They challenge comfort zones, legacy players, and entrenched interests. And they require more than just ideas. They demand commitment, collaboration, and usually a good dose of risk-taking. But when those pieces come together, that's when progress happens.
All right, you've got me curious now. What's next? What do they need to actually make this vision happen?
Well, David, one of the key elements to making this vision happen is the people. It often starts with those who aren't exactly by the book, the ones willing to question norms and push forward with fresh perspectives.
All right, you've got me intrigued. Are we talking mad scientists? Rebels? Who's making the cut here?
A bit of both, actually. Take Johns Hopkins Medical School's founders. When they set out to create their vision, they didn't just recruit people with impressive resumes. They went beyond the established norms of their time. They looked to Europe, not just Harvard, for inspiration. They wanted progressive, innovative thinkers, people like William Welch, William Halsted, William Osler, and Howard Kelly.
All right, I know those names probably mean something. To somebody. But what made them so special?
Each of them brought something unique to the table, not just brilliance, but a willingness to challenge the status quo. Welch was a pioneer in medical research. Osler revolutionized bedside teaching. Halsted pushed the boundaries of surgical techniques, and Kelly was known for innovation in gynecology. But they were also very human, eccentric, rebellious, and sometimes downright controversial. And they were young. In a way, they weren't afraid to ruffle feathers.
Okay, but let's be honest. How often does being rebellious actually work? I mean, we're celebrating these folks now, but I'm betting they weren't exactly winning popularity contests back then.
Oh, they were definitely pushing boundaries, and that came with resistance. But that's kind of the point. Change doesn't come from people who fit neatly into the system. It comes from those who ask, why does it have to be this way? That's what makes their story so powerful. They weren't there to uphold the status quo. They were there to break it and create something better.
All right, so let's bring this back to BYU. They've got Dr. Mark Ott as their inaugural dean. Is he, I don't know, the next Osler or Welch?
That's the big question, isn't it? Dr. Ott is clearly brilliant and accomplished. He wouldn't be in this position otherwise. But what really matters for transformational change is whether he and his colleagues are willing to challenge conventions, to step outside the norms, and build something new. Innovation doesn't thrive in complacency. It thrives in bold, visionary leadership. And only time will tell if that's what we'll see here.
So, we're waiting to see if he's ready to shake things up? I mean, no pressure or anything, right?
Exactly. Because ultimately it's not just about him, it's about the kind of people he chooses to surround himself with and the culture they create. New institutions need more than just names. They need innovators, disruptors, and collaborators who are driven by a shared vision, not the status quo.
All right, that's a lot of responsibility. But hey, sometimes it's the unexpected people who end up stepping up the most, right?
David, thinking about Dr. Ott and the kinds of leaders we were just discussing, doesn't it seem like every major leap forward, whether in healthcare, education, or any field, always hinges on someone stepping up in ways no one quite expects?
All right, I'm intrigued. Are we talking secret superheroes here or just regular folks who somehow end up surprising everyone?
A little of both, honestly. Take Mary Elizabeth Garrett, for example. She wasn't a doctor, wasn't even formally part of the medical field. But in the late 19th century, She became one of the biggest reasons Johns Hopkins Medical School even exists as it does today.
Wait, how does that even happen? I mean, let's be real. How does someone completely outside the medical world pull off something like that?
Well, Garrett was a philanthropist and deeply committed to advancing the role of women in society. When Hopkins was struggling to fund the medical school, she stepped in, not just with her financial support, they desperately needed that, but with conditions. Her money came with a set of demands that were, frankly, revolutionary for the time.
Conditions? Like, take it or leave it.
Exactly. She insisted that women be admitted on equal terms with men, a non-negotiable demand. And the amazing thing is, it worked. Hopkins became one of the first major institutions to truly open its doors to women in medicine, and Garrett's influence didn't stop there. She helped set a higher standard for medical education as a whole. She wasn't a traditional leader in the field, but her vision and her willingness to act shaped the future.
Wow. So she wasn't even in medicine, but she changed the game for everyone in it. That's huge. Do you think stories like hers happen today?
I believe they do, but here's the thing. It's not always where or how you expect. Champions like Garrett emerge in surprising ways, often because they see a bigger picture no one else is looking at, and they're willing to challenge the norms everyone else takes for granted.
Okay, so bring this back to BYU. Are we waiting for the next Mary Elizabeth Garrett to show up out of nowhere?
In a way, yes, but it's also about creating the kind of environment where those champions, be they donors, community leaders, or even political allies, can see the vision and step in. It takes clear purpose, bold ideas, and frankly, a willingness to take risks to inspire that kind of support.
Right? So it's not just about asking for money or waiting for someone to swoop in dramatically. It's about showing them something worth believing in.
And that's where the bold vision we talked about comes back into play. Champions don't just show up, they need to see a path where their actions can make a real difference. The question is, will BYU's vision be compelling enough to attract those kinds of transformative allies? David, to your point about BYU's vision, think back to Johns Hopkins. A vision like theirs not only reshaped medical education, but triggered a ripple effect across the field. That kind of bold institutional groundwork is exactly what allows champions to step up and drive systems change, even today.
All right, I'm listening. But when you say leverage points, are we talking about like subtle influence or full-on wrecking ball change?
It depends on the vision driving them. Take Hopkins again. They didn't just build a medical school. They redefined the relationship between science and medicine. They legitimized hospitals, helped establish nursing as a respected profession, and popularized residency training as the gold standard. It wasn't just one tweak, they fundamentally shifted how healthcare was taught and practiced.
Whoa, wait. So you're saying they basically rewired everything? Medicine, hospitals, even nursing? That's a lot.
Exactly, they created a new ecosystem, right? And by tying everything to biomedical research, they laid the groundwork for the United States to become a global leader in medicine. Now ask yourself, in today's landscape, what kind of institution could catalyze that level of transformation?
So you're saying we've got opportunities, but what does that actually look like? Are we talking about reinventing medical schools from the ground up here?
Possibly. One idea I've been thinking about is requiring all pre-medical students to major in something like health systems transformation. Imagine a whole new academic track combining economics, public health, even social change. It could prepare future doctors to be not just clinicians, but stewards of a better system.
Okay, that sounds ambitious. But is anyone even set up to make something like that happen?
Some places are starting to experiment, but we're far from where we could be. Take, for example, proposals like creating an Institute for Health Systems Transformation at a place like BYU, an interdisciplinary hub that gathers expertise from public health, nursing, even business, to prepare leaders for future challenges.
All right, interdisciplinary sounds exciting and all, but how do you actually pull that off? I mean, it's not like these departments just magically start working together.
It takes deliberate planning. You build connections, like linking with like-minded organizations. The One Health Utah Collaborative, public-private partnership, focused on transforming Utah's healthcare system to improve affordability, equity, and health outcomes by fostering collaboration among stakeholders and driving innovative solutions. And Get Health Utah, a nonprofit working to improve healthy eating, active living, and mental well-being in Utah. There are many more people and organizations working for improvement. The key will be to align the vision and incentives enough to reach a tipping point, a critical mass that can shift the system altogether.
Community engagement? So this isn't just high-level theory. You're talking about embedding these institutions in the places they serve?
Exactly. It's about recognizing that institutions like BYU's medical school don't exist in a vacuum. For them to truly transform the system, they need to connect directly with the communities they aim to impact. That's where the real ripple effect starts. And then there's competency-based education. We inherited from the Johns Hopkins era professional licensing, specialty board certification, and other educational and training requirements that are out of date. For example, if an outstanding nurse practitioner has been seeing patients largely independently for 20 years and she wants to be a family practice doctor, currently she would need to go through 7 years of education and training. That makes no sense.
All right, I'm with you. But it sounds like designing these institutions is just the first step. What's next? What does it take to make that kind of long-lasting impact?
Good question, David. Designing these institutions is crucial, but the real key to long-lasting impact lies in how they implement those designs and remain adaptive. Take BYU's new school, for example. If they make strong, intentional moves now, they could redefine healthcare for decades.
Decades, huh? That sounds like a pretty big deal. But, how exactly does one medical school ripple out like that? I mean, where do those big, lasting effects actually come from?
Great question. It comes down to influence. Institutions like this don't just produce one kind of outcome, like doctors. They create a culture, set standards, and inspire others to follow suit. Think about Johns Hopkins. It changed how we think about medicine, education, even public health, and its impact is still unfolding more than a century later.
Okay, so you're saying it's like planting a tree? The roots might be small now, but eventually it reshapes the whole landscape around it?
Exactly. But those roots have to be deliberately planted. It's about embedding principles like equity, prevention, and whole-person care into the foundation of the institution. And more than that, it's ensuring those principles endure by influencing others, students, colleagues, policymakers, even entire communities.
Yeah, but how do you make sure it sticks? Like, what stops bold decisions today from, I don't know, getting watered down or forgotten in 5, 10 years?
Consistency and follow-through. Institutions need strong leadership willing to hold the line on their vision, even when it's uncomfortable. They need systems that track outcomes and adjust strategies, so they're always walking the talk. And just as important, they need to inspire the people they touch, not just students and staff, but donors and partners, to stay invested in that vision.
So it's not just about having flashy ideas. It's about creating a kind of legacy, something that keeps the ball rolling even after the first leaders are gone.
That's exactly it. Legacies like Hopkins weren't built overnight. They were built through a relentless commitment to a better future, a refusal to settle for the way things were. And here's the really inspiring part. Institutions like BYU's new school have that opportunity right now. They're in a position to ask, what do we want medicine and the health system broadly to look like for future generations?
All right, I gotta say, the stakes feel pretty high here. Like, no pressure, but BYU or any new medical school might be setting the tone for, what, the next century of healthcare?
Potentially, yes. But here's the optimistic part. We've seen it before, and we know it's possible. By focusing on values that prioritize well-being, equity, and collaboration, they can drive changes that outlive us, all of us.
All right, Dr. Ramirez, you've officially inspired me. I'm sold on the idea that transformation can start in the smallest places. Any final thoughts for all of us listening in?
I'd just say this. Sometimes the biggest impacts come from the smallest beginnings. And whether we're talking about medical schools or our own communities, the question worth asking is the same. What kind of future are we willing to fight for?
And on that note, well, that's all for today. As always, Sophia, it's been such a pleasure. And to our listeners, thanks for tuning in. We'll catch you next time on It's Time.